Welcome again. We hope the topics we have shared are helping you. This month, we will talk about depression and anxiety. These are common problems. Sometimes they're hard to see or understand. When we try to do our daily responsibilities, we may not realize we are working harder than someone without depression. Or we may know we are depressed but don't know how to start feeling better. This month, we will help you face and manage these feelings. We talked a little about this topic before, but it is so important that we want to go over it again and give more ideas. If you see yourself in these symptoms or want more help, remember your community health worker is always ready to help you. Before we talk about depression and anxiety, we need to know what they are not. Depression and anxiety are not weakness, lack of spirituality, madness, ignorance, sin, or not praying. Depression and anxiety are illnesses, like diabetes or high blood pressure. Many people feel shame, but ignoring them will not help. Doctors can often diagnose these problems and help manage them. Sometimes tests show vitamin or health issues that explain symptoms. Causes can include past abuse, older age, some medications, family or work conflicts, loss of loved ones, gender, genes, big life changes, alcohol or substance use, chronic illness, or isolation. We can't always know the reason. We are not weak because of our genes, and we cannot prevent most causes. This month, we will learn what depression and anxiety really are and what we can do to help ourselves. What is depression? First, depression is very common. 1 out of 3 people have had it at some point in their life. 1 or 2 out of every 4 people with diabetes have depression. Next, depression is often poorly treated and difficult for patients to describe to their doctors. Depression is more than feeling sad for a few days. It lasts for weeks, months, or even years and can make life very hard. Depression is a serious disease affecting how we feel, think, and handle daily activities like sleeping, eating, or working. People who have depression often have anxiety. Anxiety is worry or fear about something in the future. It can make your heart beat fast and your body tense, causing other diseases or conditions. Learning to manage anxiety can help you feel calmer and live more peacefully. Like diabetes, depression is not a feeling. It is a diagnosis and needs to be made by your doctor. Here are some conditions individuals who are depressed may have: feeling sad or empty, losing interest in daily life, eating too little or too much, sleeping too little or too much, feeling very tired, feeling angry, worried, hopeless, or guilty, headaches, stomach pain, or other body aches, or thinking about death or suicide. Note: if you are having thoughts or a plan of harming yourself or others, you need help. You can tell you CHW, call 911, tell your doctor, go to the hospital. If you have a plan to harm yourself, you need help today. Some anxiety symptoms are like depression, but others are different. Common signs of anxiety include worrying too much about daily things, trouble controlling worries or feeling nervous, feeling restless or unable to relax, trouble concentrating or feeling tired, trouble sleeping, feeling irritable, dizzy, short of breath, sweating, or needing the bathroom often. Children and teens may worry a lot about school, sports, family fights, or disasters like shootings, earthquakes, or wars. Adults may worry about work, health, money, children, being late, or household tasks. Anxiety can also cause physical symptoms that make daily life hard. This may feel like a lot, but there is help. Depression and anxiety are hard to face alone. Talk to a community health worker, doctor, or pastor. We are not meant to be alone. I like the book of Acts in the Bible, where it often reminds us that God created people to be part of a community. Being part of a group or church can help us get support, encouragement, and care. A friend or community health worker can guide us and help us start feeling better. A very important point: if you or someone you care about feels like hurting themselves or others, get help immediately. Call 988. Help is available. Don't wait. Call or text for support. What is the step or goal you have? Find 2 to 3 things you can do this week. For example, talk to your CHW every Saturday at 3 p.m. Make an appointment with your doctor to discuss depression and anxiety. Sleep 8 hours per night this week. Eat 5 to 9 fruits or vegetables daily, or be physically active. Do you remember how much? 20 minutes, 3 times per week. Setting goals or plans is so important to things going better. This great proverb reminds us of that. Without guidance, plans fail. With many advisors, they succeed. When we are anxious or depressed, the last thing we want to do is nothing. We often want to be alone and do nothing, but you must make yourself do the opposite. Find others to be with you and plan something. It may sound small, but taking care of yourself can be the first step in moving from depression and anxiety. Getting your flu shot, going to see the eye doctor, for example, are 2 ways that you can plan to live a healthier life and feel better that you are going to get through a difficult time. Do you need help connecting to vaccine or eye referral services? If so, your CHW can help connect you. We are here to walk your journey with you. Let us know how we can help. Thank you for listening.